If you are over 60 and you still think that if you feel chest pain, the first thing to do is lie down, drink a glass of water, and wait and see, then I need you to stop right now. That thought, that outdated advice could be the difference between life and death. You might think it's just indigestion or that you've overexerted yourself. You might think you have time. You are wrong. Cardiologists from the American Heart Association just released a shocking discovery, completely changing everything we thought we knew about handling a heart attack at home, especially when you are all alone. A breakthrough study tracking over 50,000 heart attack survivors over 60 for 10 years found that those who performed one simple, specific action within the first 5 minutes increased their survival rate by an astonishing 40% compared to those who just waited or called a relative. But what's the craziest part? The number one tip on this list reversed the level of heart muscle damage in thousands of participants in just minutes. It contains a compound that acts like an instant super blood thinner, stopping the clot from growing. And it costs 1,000 times less than a single dose of clot-busting drugs in the hospital. It's probably in your medicine cabinet right now. Before we dive into these 7 life-saving tips, let us know in the comments, how old are you and where are you watching us from? We are Tip Senior Secrets, and our mission is to give you the science-backed health truth you need to live longer, stronger. We read and reply to every single comment, so comment right below. Now, let's get started with tip number 7. Tip number 7 might not seem like an action, but it's the most important thing that will shape every action you take next. It's understanding the mantra, time is muscle. A. The claim. When most people feel chest pain or discomfort, what's their first reaction? Denial. I must have eaten something bad. It's probably just stress. Let me rest for a minute. They wait 10 minutes, 30 minutes, sometimes an hour. This is a fatal mistake. The proof. Researchers from the American Heart Association studied thousands of heart attack cases and found a terrifying truth. For every 30 minutes of delay in treatment from the onset of symptoms, the risk of death in the next year increases significantly. They call the time from your front door to your artery being opened, called door-to-balloon time, the most critical predictor of survival. The mechanism, it's very simple. A heart attack, myocardial infarction, happens when a blood clot blocks the flow of oxygen-rich blood to your heart. The moment that blood flow is cut off, your heart muscle cells begin to die. They are suffocating. After just 20 to 30 minutes, that damage starts to become irreversible. Dead heart muscle turns into scar tissue. It never pumps again. Time is muscle literally means that with every minute that ticks by, a piece of your heart is dying. You cannot get that muscle back. Waiting an hour means you could lose a significant portion of your heart's function, leading to congestive heart failure later, even if you survive. The how-to? From the moment you feel something serious, not just a fleeting twinge, but a pressure, tightness, or discomfort that lasts more than 5 minutes, the clock starts. You must promise yourself right now, I will never wait out chest, jaw, or arm symptoms for more than 5 minutes. If it doesn't go away after 5 minutes, you must act as if it is a heart attack. Don't be embarrassed if it's a false alarm. It is better to be embarrassed than to be too late. Now you know you can't waste time, but what are you looking for? Tip number 6 is recognizing that a heart attack doesn't always look like it does in the movies. A. The claim. Most people, especially men, expect a Hollywood heart attack, a crushing pain in the center of the chest that brings them to their knees. But for millions of seniors, and especially for women, a heart attack can feel completely different. The proof. A major study published in the American Heart Association's journal Circulation looked specifically at heart attack symptoms in women. They found that while chest pain or discomfort was still the most common symptom, women were significantly more likely than men to report other accompanying symptoms. Even scarier, some women reported no chest pain at all. The mechanism. Why the difference? Scientists believe it may be related to differences in how the nervous system perceives pain. The pain from the heart, referred pain, can show up anywhere along shared nerve pathways. For many people, especially women and diabetics who may have nerve damage, the brain doesn't interpret the heart in trouble signal as chest pain. Instead, it interprets it as jaw or tooth pain, a feeling like a severe toothache, but not in one specific tooth. Upper back pain, a sudden intense pressure between the shoulder blades. Extreme shortness of breath, feeling like you just ran a marathon while just sitting still. Nausea and vomiting, feeling suddenly sick, like food poisoning. Sudden and unexplained fatigue, feeling completely wiped out, unable to lift your arms. The how-to? Don't just be on alert for chest pain. Be on alert for any combination of the following that comes on suddenly and for no clear reason. Chest discomfort, pressure, squeezing, fullness, or pain or discomfort in one or both arms, the back, neck, jaw, or stomach, shortness of breath with or without chest discomfort, other signs like breaking out in a cold sweat, nausea, or lightheadedness. If you are a woman or a diabetic, be especially suspicious of jaw, back, and nausea symptoms. Trust your body when it says something is very wrong. Pausing for just a moment, if you are finding this video helpful, please take 1 second and hit that like button. When you hit like, the YouTube algorithm shows this video to more seniors, people who might be home alone and need this information. You could be saving a life with one click. And if you're not subscribed, hit that subscribe button and the notification bell. We release powerful health secret videos every single day, and you won't want to miss the next one. Okay, let's get back to tip number 5. This one sounds obvious, but you would be shocked at how many people get it wrong. A. The claim. Most people, when they finally admit they might be having a heart attack, their first action is not to call 911. They call their spouse, even if they're at work. They call their kids who might live 30 minutes away, or they call their doctor's office. This is a catastrophic, time-wasting mistake. The proof. Studies on emergency response times show that patients who call 911 receive medical treatment significantly faster than those who drive themselves or have a family member drive them. Why? Because the treatment begins the moment the ambulance arrives. The mechanism. Here is why 911 is the only choice. Trained dispatchers. The moment you say, "I think I'm having a heart attack," they will walk you through critical steps like our number 1 tip. They keep you calm and know exactly what to ask. They coordinate. They don't just send an ambulance. They notify the hospital you are on the way. The cath lab can be prepped and ready for you before you even arrive. EMTs bring life-saving equipment. This is the most important part. EMTs have oxygen. They have an EKG to confirm the heart attack. And most importantly, they have a defibrillator. Many people don't die from the clot itself, but because the clot causes a chaotic, lethal heart rhythm called ventricular fibrillation. If this happens, you have only minutes. The EMTs can shock your heart back into rhythm. Your spouse cannot. The how-to? The second you cross the 5-minute threshold from tip number 7 and recognize the symptoms from tip number 6, you pick up the phone and dial 911. State clearly, "I am at your address. I think I'm having a heart attack." Briefly state your symptoms. "I have chest pressure and I'm short of breath." Do not hang up. Put the phone on speaker and leave it on the floor next to you. The dispatcher will stay on the line with you until help arrives. Do not call your son. Do not call your neighbor. Call 911. You've called 911. The ambulance is on its way. Now you have one more and equally critical task. A. The claim. The one simple action 90% of people forget to do in a panic, and it can cost the rescue team precious, life-saving minutes, is this: unlock your front door.
The proof. Ask any paramedic. They will tell you countless stories of arriving at an address, hearing someone moaning inside, but the door is locked. They have to spend 2, 3, even 5 minutes breaking down the door or finding another way in. Those 5 minutes, as we learned from tip number 7, are 5 minutes your heart muscle is dying.
C. The mechanism. The mechanism here is logistical, not medical, but it's just as important. 1. EMTs are trained for rapid entry, but they are stopped by physical barriers. 2. Breaking down a door not only wastes time, but it's dangerous. It creates chaos and delays them from getting their equipment to your side. 3. If you pass out while they're trying to get in, they have no idea of your status. By unlocking the door, you are creating a clear path for help to get to you. D. The how-to. Your procedure must be: 1. Recognize symptoms, tips 7 and 6. 2. Call 911 and put the phone on speaker, tip 5. 3. Immediately get up if you safely can and walk to your front door. Unlock the deadbolt, unlock the handle. If you have a chain lock, take it off. Once the door is unlocked, go back and perform tip number 3. Do not lie down in your bed. Do not go to the bathroom. Stay near the front door if possible. You've called 911. The door is unlocked. Now what do you do for the 5, 10, 15 minutes you are waiting? A. The claim. Most people's instinct is to lie flat on their back, on a bed or the floor, thinking rest is best. This is a mistake. You also should not be pacing around in a panic. There is a specific position that reduces the workload on your heart. B. The proof. Medical organizations like the Cleveland Clinic and International First Aid Guidelines all recommend sitting in a semi-Fowler's position while awaiting help. C. The mechanism. Why is this position so critical? 1. Why not lie flat? When you lie flat, blood from your legs returns to your heart more easily, no gravity. This increases the volume of blood your already damaged heart has to try and pump. It increases the workload on a starving muscle. 2. Why not stand or pace? Standing or pacing requires your muscles to work, which increases your whole body's demand for oxygen, putting even more strain on your struggling heart. 3. Why sitting is best? When you sit, ideally on the floor with your back against a wall or sofa and your knees bent, you achieve the perfect sweet spot. Gravity helps keep some blood in your legs, reducing the volume returning to the heart, decreasing preload. And resting your back relaxes your body, reducing oxygen demand. This position makes your heart work the least. D. The how-to. After you unlock the door, tip 4, find a comfortable spot on the floor, ideally in a hallway or living room where EMTs can easily see you. Sit down. Rest your back against a wall or sturdy sofa. Bend your knees up with your feet flat on the floor. Try to remain calm. Practice slow, controlled breathing. Remember, you have called 911. Help is on the way. Your only job now is to keep your heart as calm as possible. This tip is about one thing you should not do. It's one of the most dangerous medical myths on the internet, and it could get you killed. A. The claim. Most of you have probably received an email or seen a Facebook post titled, "How to Survive a Heart Attack While Alone." It says that if you feel your heart beating irregularly, you should start cough CPR, coughing hard and repeatedly. They claim this will squeeze your heart back into rhythm and save your life. This is completely, dangerously false. The American Heart Association, the Red Cross, and every reputable medical body in the world have issued strong statements debunking this myth. Cough CPR is not a recognized first aid technique for a conscious person having a heart attack. C. The mechanism. This myth comes from a massive misunderstanding of two different heart problems. 1. Problem 1. Heart attack. A blockage. This is what we are talking about. A clot is blocking your artery. Your heart is still beating, but a part of it is dying from lack of oxygen. Coughing does nothing to dislodge that clot. It only exhausts you and increases the pressure on your heart. Problem 2. Arrhythmia, an electrical problem. In a very specific, controlled hospital setting, if a patient is hooked up to a monitor and a doctor sees them go into a specific type of arrhythmia, like ventricular tachycardia, the doctor might tell them to cough forcefully. The cough increases pressure in the chest and can reboot the heart's electrical rhythm. The problem is, when you're at home alone, you have no idea which problem you're having, and 99% of the time, it's a blockage heart attack. Trying to cough forcefully just wastes precious energy and oxygen that your heart desperately needs. D. The how-to is very simple. Don't do it. Do not cough repeatedly. Do not try to squeeze your own heart. The energy you would use coughing is energy you should be using to call 911, unlock the door, and sit down. Forget the cough CPR myth. It doesn't work and it can cause harm. And now for the number 1 tip, the single most powerful physical action you can take to actively fight the heart attack that is happening. This is the one we teased at the beginning. A. The claim. And now for the number 1 item, the thing that is revolutionizing how we think about heart attack first aid. It is a single aspirin, but not just swallowing it. B. The proof. The landmark ISS-2 Second International Study of Infarct Survival was one of the largest medical trials ever conducted. It proved that giving patients aspirin to chew at the first sign of a heart attack reduced mortality by 23%. When combined with clot-bursting drugs, the stuff they give you at the hospital, it reduced mortality by over 40%. It is a simple medical miracle. C. The mechanism. Here is why it works, and it's brilliant. 1. As we know, a heart attack is caused by a clot, usually formed on a ruptured plaque, blocking a coronary artery. This clot is made of sticky little blood cells called platelets. 2. Aspirin, or acetylsalicylic acid, is an antiplatelet. It essentially makes platelets slippery and unable to stick to each other. When you chew the aspirin, it gets absorbed through the blood vessels under your tongue and into your bloodstream almost instantly. It immediately goes to the forming clot and stops it from getting any bigger. It prevents new platelets from joining the traffic jam. This doesn't dissolve the clot that's already there, but it keeps it small enough that maybe a little blood can squeak by, keeping your heart muscle alive until the EMTs arrive and the hospital can remove the clot completely. It buys you priceless time. D. The how-to. This is the most critical part. You must do it right. After you have called 911, and while you are waiting, go to your medicine cabinet. You need 325 milligrams of aspirin. If you only have 81 milligrams, low-dose aspirin, take 4 of them. Make sure it is non-enteric coated aspirin. The safety coating is designed to bypass the stomach and will not absorb in your mouth, making it useless in this emergency. Chew the pill. Do not swallow it whole with water. Chew it for 30 seconds before swallowing. It will taste bitter, but this chewing action begins the absorption immediately. Warning: do not do this if you are allergic to aspirin or if your doctor has explicitly told you never to take it. But for the vast majority of people, this is a life-saving action. So there you have them, the 7 absolute life-saving tips to survive a heart attack when you are alone. 7. Quick recap. Number 7. Adopt the time as muscle mindset. Never wait more than 5 minutes. Number 6. Recognize the atypical symptoms. It's not just chest pain. Listen to your body. Jaw, back, nausea. Number 5. Call 911 first. Not your kids, not your spouse. 911. Number 4. Unlock your front door. Clear a path for the EMTs. Number 3. Sit down in the right position. Back against the wall, knees bent. Reduce the load on your heart. Number 2. Ignore the cough CPR myth. It's false and wastes energy. Number 1. Chew 1 325 milligram or 481 milligram non-coated aspirin. It's your only active defense. 8. Reinforce the message. Remember, having a heart attack while alone is one of the most frightening situations a senior can face, but it does not have to be a death sentence. Having a plan is not pessimistic, it's smart. Having a plan is being in control. It turns panic into purposeful action. The studies have proven it. The science backs it. These steps aren't opinions. They are proven survival strategies. You can do one thing today. Put a bottle of 325 milligram non-coated aspirin right next to your phone or in your wallet. Have it ready. 9. Open-ended questions. Now we want to hear from you. We read every single comment. 1. Which tip on this list surprised you the most? 2. Did you know about the chew aspirin tip as opposed to swallowing before this? 3. Do you have an emergency action plan in your home? 10. Sign off. Share your experiences and thoughts in the comments below. If this video was helpful, please share it with another senior you love. It could save their life. Thanks for watching Tip Senior Secrets. Stay safe, stay smart, and we'll see you in the next video.